Hi, everyone. Welcome back to my YouTube channel. This is Kira. I'm with MP Now. I wanted to welcome you guys back. I come on every Sunday, and I'm here to talk to you guys this week about prescription writing, which is one of the very important roles that we do when we are taking care of patients. And I know for a fact that before I graduated, I maybe wrote one or two prescriptions in clinicals, and it was basically it's something that can be learned, very quickly in a day. You want to get the didactic information down first and down packed, of course, and diagnosing and assessing your patients. But prescription writing is one of the things that we do. Just as an aside, I do go over prescription writing and give you an actual example of what a prescription looks like in my online course at mpnowllc.com. So if you want more information or a more in-depth explanation of prescription writing, you can go there, purchase the course, or just listen to this video. It gives you a sufficient piece of information. Go online, Google it. You'll also get a lot of information there as well. But I was very surprised to know that I didn't really know much about prescription writing. So big thing, all of our prescriptions are basically electronically sent over to the pharmacy now. So you really don't have to write a prescription, but there are instances where, we can't really depend on technology. We got to have a backup. Sometimes you have to do something called downtime paperwork or paper charts. So you got to know how to write a prescription if you have to. It's something that, you don't want to make a mistake, because mistakes with prescriptions writings have caused millions of injuries to patients and billions of dollars in, error costs. So it's something you want to just have familiarize yourself with. You can always ask a colleague, Google, or just look it up to see how you write a prescription, because it's a little different between writing a prescription for a medication and prescription for writing for a radiology test, which I'll explain to you. So when you write a prescription, basically you want to make sure, I did a little makeshift prescription for you guys to show you what it would look like. So let me just break it down for you real quick. You'll have the state of so-and-so up top. You'll have your name and your address of your facility that you're working at here, along with your NPI. You definitely need your NPI. That's a big point. If you are in a state that has, if you collaborate with a physician, you'll have your physician's NPI number, physician's name and NPI number here, their address and phone number if needed. Then you'll have the patient. Big thing is you need two identifiers. Make sure you have the patient's name, date of birth. All right. If you're writing a narcotic, make sure you put the date here. All right. Then basic things that you need on a prescription: type of prescription, the strength, how often the person is supposed to use it, and how many, which are the instructions, and for what. And then also how many tablets they're going to be getting, or how many mLs, or how many inhalers they're going to be getting, and if they're going to be doing refills or not. Also down here on this section, they'll have somewhere where you can put if you want refills. And then over here in this corner, you need to check this box off if you don't want them to substitute a medication. For instance, you want them to have this exact medication, or maybe they can do a generic instead for insurance purposes, but maybe the patient doesn't take well for the generic. They need brand name. And then you also want to make sure that you sign here. Now, to back up, I did mention something about narcotics. When you write a prescription for a narcotic, you have to make sure that you write out the number of pills in words. So you'll say 10 and then write the number 10, and then in parentheses next to that, write out 10, TEN, so that the pharmacist will know where they'll call you. And also you'll have like your phone number up here, address. So if there's any issues, they'll call you. One of the things with prescriptions, if you're going to be calling them into the pharmacy, you want to make sure that you have the patient's name and birth date. And for you, you need to make sure that you have your NPI number and a phone number for that they can call you back at, just in case you missed something when you're doing the recording, or if they have a question. And a lot of times our MAs will be calling these prescriptions in for us. And just make sure that you give them clear directions as well. And one other thing that I wanted to go over is on the side of your prescription, you'll have like a barcode, which will tell you which number prescription that is in the series. of your prescriptions. So that's important because of the fact with, sorry guys, that's important because one of the things, so I work in New Jersey. So one of the things you want to make sure that you do is if you're switching jobs, you destroy your prescription blanks. You don't want to leave prescription blanks at your jobs. So what happens is you have to go online, the state of New Jersey, get a prescription destruction form printed out. Two people besides you have to fill that form out. They write down what number series that's left in that series and what's the last one left, so that they can make sure that there's no diversion, such as drug diversion, DEAs. You don't want someone writing a million pills of Percocet under your DEA because it'll shut you down. It'll shut your practice down. It's just a big mess. Nobody wants to go over that. One of the big things that I like to do when I call in a prescription to the pharmacy, I usually like to speak to the actual pharmacist. I really don't like leaving a message. I don't know why, because they usually, if you're in a really busy practice and you have like a lot of patients, you don't want them calling you back saying, oh, you forgot this, you forgot that. It kind of adds that extra, like, busy work for you. So I usually like to call the pharmacist so that if they have questions, they can ask me right then, right there, and we're done. Make sure that you don't use any unacceptable abbreviations on your prescription blank as well. And also, if you're going to be sending like a patient for radiology, so it'll be the same exact way that I told you with a prescription for a medication. The big difference is you'll write the name, you'll write the test that the patient needs to get. And you need to make sure that you have a diagnosis code. So for instance, say this is a prescription for a drug test, for an x-ray. So you put in this area, the thing that will change is chest x-ray, AP lateral diagnosis. You could do R05 or just put cough because they need to attach that x-ray to a diagnosis code. And I already mentioned the thing about the narcotics, so you just want to make sure you be safe with that. Big thing, if you don't have the carbon copy prescriptions, make sure that you make a copy of the actual prescription that you write, the hard copy, especially for narcotics, because there's been instances where there's been nurses that had patients change their prescription number, quantity of narcotics, and they've had the original copy and they noted that the patient changed it. So it's really important to cover yourself and, make sure that you do everything you can to practice safely and keep your DEA and your MPI clean and just be as consistent as possible. So that's my little tip this week about prescription writing. You can find me at mpnowllc.com. If you have any questions, send me a message. You can also send me an email if you have any questions about anything. And I do have my mentorship panel open. So be sure to like my page on Facebook at mpnowllc and also follow me on Instagram at mpnowllc. All right. See you guys next Sunday. Bye.